If you're looking to apply for those band 5, 6, or even 7 roles in biomedical science, you might get asked this question. Hi, my name is Abdul and I'm a fully qualified biomedical scientist. So what is the question that you might get asked at interview? Well, you'll get asked a bunch of different things regarding training, health and safety, and quality in a lot more detail than you would at the lower levels, say for example in band 2, 3s, 4s and 5s. So the question that you might get asked is, you'll probably be prompted to describe the process of introducing a new piece of equipment into the lab to assure compliance with ISO 15189. So how do we do that? How do we describe the process and what is it? So that's what this video is going to show you. It's going to show you how the labs actually implement a new process or a new equipment in this case, and what you need to do and why it's important. So hopefully this video will help you prepare yourself for when you get asked that question and you're not blindsided. Firstly, I'm going to explain what ISO 15189 actually is. ISO is a certification by UCAS specific to medical labs and sets out standards for labs to follow. So UCAS stands for UK Accreditation Service. And what UCAS do is they assess the lab on their health and safety, their training and education of their staff, acceptable turnaround times, patient sample collection, so how are they collected properly, and is there a process for it? What process is there if something goes wrong as well? Testing and interpretation of results, so the labs is assessed on how they do their testing, whether it's accurate and whether there is a proper quality control measure in place for result interpretation. With any significant change, there needs to be a change control, and bringing a new piece of equipment into the lab is a significant change. So a change control procedure, what is it? It's basically a systematic method that is used to plan, evaluate and test the significant change, and is a fundamental part of any QMS. This ensures that changes are correctly managed and documented, they meet the service user's needs, are communicated effectively and thoroughly evaluated for any potential risks to ensure a smooth change process. So this is the outline for the change control process, and I'll go through each one by one. So firstly, we need to create a plan and justify why we want this new piece of equipment and whether it's necessary or not. We need to distinguish if the change is minor, for example, a change in supplier or a major change such as a new tissue processor. More factors to discuss include feasibility, which means do we have the space, resources and time to implement the new kit? Can we even afford it? What are the start and target end dates? Who is responsible for overseeing the change? Do we have a supplier and service agreement? Again, the UCAS standards are referenced next to each point in brackets. So the next stage is to assess the change and gain approval. Things to evaluate are the risks and other elements of QMS affected. Risks can be evaluated using a risk matrix, which scores each risk based on severity and probability and how this can affect service users. We also evaluate risk of service continuity during the change at all stages of workflow. And cost assessments can be done as well. Other elements of QMS affected are listed here below. This is not an exhaustive list. Elements such as documentation such as SOPs, competencies and lab instructions have to be considered, as well as training and storage of records, just to point out a few. Now focus on how to implement the equipment by getting things ready for testing. We would need to update our inventory to include the new kits, create files to store equipment documentation, set up any stock ordering to help test if necessary, and writing or updating competencies to include the new kit. We would then need to verify or validate the new piece of equipment. And so what do these mean? Verification is the testing of the equipment to the manufacturer's standards and parameters to see if they have built their product right. Validation aims to test the kit outside of the manufacturer's claims, according to our own protocols. And this is to see if it is fit for purpose. Again, this is all documented. The validation/verification process can be split into these stages here, and the UCAS standards they represent are again referenced in brackets. So firstly, the design qualification. This is simply the design of the product. Does it look like what the supplier says it should look like? Next is the installation qualification of the product, which takes into account the piping, space, and any other accessories required, and also includes any documentation of operating and working conditions. Next is the operational qualification. This evaluates calibrations, operating and maintenance procedures, and ensures the kit is operating as designed by confirming the upper and lower parameters using internal quality control checks. The OQ also looks at training, so who is to be trained and who does the training. Finally, the performance qualification. This is done with no assistance from the supplier and tests the kit using our protocols and parameters. And we assess the performance using like-for-like comparisons in-house or using EQA results from other organizations. We can also test the sample stability under normal and worst conditions. So here's a quick example of a validation verification process for a new tissue processor. So we can select a range of tissue samples for testing, such as skin, gynae, or breast. These samples are cut in roughly the same size and placed in labeled cassettes, each going into the current and new tissue processor. Samples are then embedded, cut, and stained using H&E specials and IHC staining. So these stain slides are given to pathologists to score the staining without telling them which section has been in which processor. After scoring, we can collect the data and proceed with the change control. So after sufficient testing, we can now review the data for the change and discuss if the need for change has been met. This is discussed between the departmental, quality, and clinical leads who approve each step of major change controls. The review can be conducted using audits, quality indicators such as turnaround times, and meetings with key shareholders involving other service users and staff. Once the review has been complete and everyone is happy with the equipment, you can now set a go-live date where the equipment is in full operation and all documentation are in order, such as SOPs and lab instructions, and competencies and training programs. All the documents of the change control should be recorded and saved as well for referral. We can then finally sign off the new piece of equipment. We have audit schedules set in place to ensure the equipment is working as they should. We have servicing and maintenance schedules, and also submit extension of scope to UCAS, and also, if necessary, enrolling in NEQAS for new processes. And that is it. I hope you've gained a better understanding of the quality procedures involved in implementing a new process. So with that, when you get asked that question during your interview, you're better able to answer that question. And to be honest, you don't even have to show off this knowledge at just the band 6 or 7 interviews. You can show off this knowledge at the lower level and really impress your hiring manager or whoever's interviewing you. With that being said, I wish you the best of luck and take care.